I started a series and I've done part 1, whereby processes of IVF, what you need to know. I think where I stop is said there are going to be investigation. I'm talking about investigation of male infertility. Majority of professionals, what they normally do most for male factor who want to do IVF is semen analysis. But I want to tell you that majority of failed IVF cycle, when we are talking about the embryo development, the quality of embryo, the pattern of embryos developed from that process, up to 70% lies with the quality of sperm that a man dropped for that process. I want to let you know that semen analysis is not a fertility test. And when you are doing semen analysis, 2 important factors: sperm count, motility, and morphology. You see, sperm count, even if your sperm count is low and it's not chrysospermia, whereby the sperm cells present in your sample is too low, one can use what we call ICSI, intracytospermic sperm injection method. Is like an advanced IVF to achieve pregnancy when the sperm count is low. But when there is a problem with the sperm count and motility, ICSI will still take care of it. But I want to tell you that what we call morphology is more important and is directly proportional to whether a woman will achieve pregnancy or achieve good embryos or not. So if we are doing normal semen analysis, we cannot discover a lot of things in semen analysis, especially the morphology. Majority of laboratory, what they do is normal light microscopic morphology. I would suggest that what every man who want to do IVF, especially if you've lost one cycle before, is sperm function test. Because if you do sperm function test, the professional will be able to determine the genetic content of the sperm cells. DNA test. In semen analysis, the result could look fine. But when you investigate further, especially when you do semen sperm DNA test, you'll be able to know that this sample that we claim it is very good, when we do semen analysis, we will not be able to achieve pregnancy. Whether your sample, your result is good or not, I used to advise men that you need to take supplements to improve the quality of your semen, the count of your semen, from the time you start that procedure until the day they want to collect your sample for IVF. Sexual arousal. For some of people that they have erectile dysfunction, you know that you always have erectile dysfunction anytime you want to have sex with your wife. It's not always going to like that. So if you want to do IVF, it is better that maybe at the time you are okay, you are fine, your emotion is balanced, you can go and freeze your sample. Freeze a good sample from your body, because by the time they ask some of you to come and donate your sample for your wife, whether they recruited when they have done egg retrieval, they now ask you to come and drop your semen. Some men find it difficult at that point to produce optimum good semen quality. Why? Because some of them, they have problem with their erection. Bola will rise, will not be strong. But because the sexual arousal is not at peak, the volume of the semen they will produce will be very low. The quality of that semen will be very low. If any man find himself in that kind of problem, before the day they want to do egg retrieval, go and meet your professional, explain to them, let them tell you to bring sample, a good sample, as at the time your body is fine, your motion is fine, you are balanced. Take that sample to them, let them do the analysis. When it is very good, you can tell them to freeze the sample. I'm talking about those men that when time they ask them to have sex with their wife or they need their sample, they won't be able to produce. This is one of the processes of IVF, male infertility investigation. Some men, they don't ask them to do hormonal test. But I want to tell you that every man that is attending fertility clinic with their wife supposed to do semen analysis and hormonal test, LH, FSH, prolactin and testosterone. Because your semen analysis may be fine, but the parameters of your hormones may not be fine. And I want to tell you that when there is this type of a situation, do you think there won't be any problem? Till I continue in part 3. My name is Wojo Adekende Samuel. I'm a practicing fertility scientist, a brand ambassador for Fertility. Till I come your way next time. God is good. Bye.